Hello, I'm Dr. Eric Goulder. I'm a board-certified cardiologist and I practice at the Heart Attack and Stroke Prevention Center of Central Ohio. Today I'd like to talk with you just a little bit about why I practice with a dentist. And that dentist is my wife, Dr. Barb McClatchy. I don't practice with her just because she's my wife. So we follow an approach to preventing arterial disease developed by Doctors Bradley Bale and Amy Dineen called the Bale-Dineen method. And that method is based on inflammation as being that final common pathway that drives the whole arterial disease process. Over the past 20 years, there's been very well developed science that shows that it's definitely inflammation that is what damages the arterial wall. And we actually had an idea that this was the case 162 years ago when Dr. Rudolf Virchow, the father of modern pathology, clearly stated that it was inflammation that was causing arterial disease. He based that on the fact that he saw inflammatory blood cells in the lining of the arterial wall where there was plaque and arterial damage going on. Well, standard of care medicine went down the wrong pathway for the next 140 years or so, thinking that arterial disease was basically just a cholesterol storage problem and not an inflammatory process. We now know differently, and once we find that there is inflammation going on that's causing arterial disease in a person, we need to ask, why is that inflammation there? And that's where my wife comes in, because of the numerous causes for developing the inflammation. 3 of them in particular I really can't do much about, and so she has to treat those. The first is obstructive sleep apnea. This is a very inflammatory process. It is when it's mild in nature, dentists can make what's called a mandibular advancement device, a mouth device appliance that goes in at night to keep your lower jaw forward and open your airway more. When it's more severe, then we're going to be sending our patients off to a sleep specialist to get treated with CPAP. The second disease state that she's involved in is periodontal disease. By the time the people in our country reach about the age of 50, 70 or 80% of us have periodontal disease, disease of the gums. And when there's periodontal disease, it's like having an open wound in your mouth. The bacteria in your mouth can get into the bloodstream and wreak havoc. And Doctors Bale and Dineen have shown that there are 5 high-risk pathogens, high-risk bacteria in the mouth that drive the arterial process. Barb's job is then to treat that so that those really high-risk pathogens, those high-risk bacteria are gone, and we're going to keep them away because we don't want them to be making your arterial disease worse. We want to stop that inflammatory process. The third entity that Barb treats is endodontic disease. That involves abscesses, what's called a periapical abscess or an abscess at the root tips of the teeth, and that would involve getting a root canal or having an extraction done and a implant put in for that tooth. So by the dentist, and especially a dentist who is Bale-Dineen trained, so they understand this whole process, taking care of those 3 things for me, and I take care of the other root causes, and there are a whole bunch of them, including things like high blood pressure and high cholesterol, something called LP-little-a, which is a bad LDL molecule, genetically determined, that is not treated with statins or lifestyle modification, chronic inflammatory diseases like lupus or rheumatoid arthritis, and just a whole host of other things. We get the whole inflammatory process to settle down, the arteries can heal, and our patients will not have heart attacks or strokes. So if you would like to learn more about the Bale-Dineen method, or if you would like to contact us regarding your preventive care, please don't hesitate to contact us at the Heart Attack and Stroke Prevention Center of Central Ohio.